school can be very difficult. And so another thing I say is don't give up. There are others around here to help you.
Hello everyone, welcome to the latest episode of The Current, Touro University, California's alumni podcast. I'm Glenn Faison, the Alumni Engagement Director here at the university. Joining us today in the Social Justice Resource Center here in the library on campus is Dr. Maricel Dela Cruz. She's a dual DO MPH graduate from 2012, so an alumna of the College of Osteopathic Medicine, and also of the College of Education and Health Sciences. Currently working as an emergency medicine physician with Kaiser Permanente in the Napa-Solano area, splitting time between the Vallejo and Vacaville facilities, correct?
Absolutely, correct.
Great. Well, thank you for joining us today, Dr. Dela Cruz.
Thank you so much for having me. Hello.
Hello. So let's just jump right in. Why don't you tell us what led you to a career as an osteopathic physician? What got you interested in osteopathic medicine? Did you always know you wanted to be a doctor?
Yeah, so in terms of becoming a doctor, I was introduced to the health field because of my mom. She is a nurse. She was a nurse. She's retired now, and she used to work at the VA in San Francisco. And I always saw her in her scrubs bringing back medical equipment, and things home. And I would be like, I want to be in the medical field. And she would say, do you want to be a doctor? And I'd say yes. And I think that it just started from as a child. They would buy me these tools, and I would play with a play stethoscope or play school bag, and it just went on from there. And in terms of the osteopathic field, as an undergrad at UC Berkeley, we had like a recruitment event for undergrad students who wanted to go to med school, and I met a DO. And she looked just like me, and I said, I want to be her. And so that's what led me to looking into osteopathic schools.
Well, great. So you're undergrad, this kind of lifetime of interest in the medical field, and now, DO. Why Touro University, California?
Touro is very special to me, for one, because I am from here, actually.
Okay.
Born and raised in the Bay Area. My parents lived in Vallejo, and I found out about this campus through the process as an undergrad looking for schools. And I did look throughout the country, but of course there is no place like home. And Touro just spoke to me in that way, and that I would be able to serve and learn within my own community.
So why don't you talk to us a little bit about how your coursework here at Touro helped prepare you for your residencies and then onto your current career. And also, if you wouldn't mind talking about the relevance of the MPH, the Master of Public Health that came along with the dual program, that would be great for our audience.
Absolutely. So while I was navigating what I wanted to do and what I wanted to be when I grew up, I was looking at different programs, either just a straight medical school, allopathic, osteopathic, and even master's programs. And I knew I wanted to be in the medical field. And of course, I wanted to do as much as possible, everything that I could. And one component was policy. And I was led to the public health field because potentially at some point in my career, maybe I would look into a leadership position or something that can have a greater effect on the big community in terms of public health. That's how we look at people as a group versus, which I love to do as a physician, the individual. Right. So I thought that was a happy harmony and marriage between the two, public health and medicine, where I could potentially affect the masses and also know how to treat an individual. That's what led me to the MPH and DO program here at Touro.
Okay, wonderful. So, I mean, you know this, everyone kind of knows in the back of their head, medical school, that's hard. Now that you're talking about a dual program, you're getting a master's degree concurrently with your doctoral degree. But it's not all work. What are some of the fond memories that you have from your time here at Touro?
Actually, I think Touro set us up in a great way in that we had good colleagues. There was a lot of multidisciplinary thinking in terms of our faculty, staff, and classmates. And my fondest memories actually are even here in this building in the library, having group study, playing, laughing with each other, trying to find fun ways to remember all these complex medical processes. We would sing songs, and some of my colleagues made YouTube videos and probably became famous doing that. But I think just that camaraderie and having that group together really helped here at Touro, and they really fostered that we work together, have groups, even I was part of the Big Sib, Little Sib program. I think that may or may not still be here, but I had a mentor and later on became a mentee as well.
Great. So I'm going to get personal for a minute, just some information that you shared with me earlier when we met. You met your husband not at Touro, but kind of sideways through Touro. Why don't you, through the public health program, correct?
Yes, right.
Why don't you share that? Do you mind sharing that with everyone?
Absolutely. So here at Touro, there is a global health program, and in the public health sector, you can either do a local tract or a global health tract. And as I was doing both the DO and MPH program, I fell into going on a global health mission trip, actually, with one of our faculty here, Dr. Mahmood.
Okay.
I believe she's still here teaching. She did pathology and she also led the global health program. And that was the first year, in addition to the medical students who went, they invited undergrad students. And my now husband happened to know someone who was in the Touro program and he was looking for opportunities, and she led him to coming to our program with us in Africa, in Tanzania. And so we were there for several weeks. We worked on a couple of projects together. Afterwards, we did a presentation at UCSF for their global health program, and we just kept on talking to each other.
Well, that's great. So you found your life partner.
I know, Touro was where everything was at. My husband, my career.
Yeah. So I mentioned that you're at Kaiser Permanente in the emergency department, working at the two hospitals here, and medical centers actually here in Solano County. You've got the trauma center in Vacaville, and just a straight ER here in Vallejo, correct?
Correct,
Okay.
yes.
So tell us what you're doing now professionally. What's that entail? You've been there since October, I think?
Correct,
Okay.
yes. So prior to starting here at Kaiser, right out of residency when I was in Philadelphia, I worked in Stockton at a county hospital, San Joaquin General Hospital, and I had a lot of experience there working with community, especially as we would describe as underserved. And now coming back home, and Kaiser actually is a great hospital. We have Vallejo and Vacaville. Like you said, Vacaville is our trauma center. And Vallejo is nice in that there are no other hospitals that serve as a county hospital almost within a certain radius. And so Kaiser Vallejo actually takes everyone. And that's one of the things in the emergency department that we do. We see everyone. We look for life-threatening emergencies. But for me, what I'm doing right now, I'm fairly new in the Kaiser system, so I'm learning the system, going through all the processes and doing my best to potentially get into leadership positions, one of which I actually am now the champion for their geriatric emergency department program. And it is through the American College of Emergency Physicians in accrediting our particular emergency departments in better serving the geriatric community. And so this opportunity opened up, and I said yes, I'd love to.
I mean, you say yes, you get a chance, right?
Exactly.
I mean, that's a good life lesson for all of us. If you want something and it's offered, say yes.
I learned from my parents when an opportunity comes along and it's knocking at your door, whether or not you're interested, you should take the opportunity, and because you might miss it. You don't want anything to pass you by, and you'll never know who you meet, what you learn, your networking opportunities, and the people that you can help and serve. You might find something in you that you never knew was there before.
Yes, definitely true. So you talked about how you were at San Joaquin Memorial, correct?
General Hospital, yes.
Sorry, San Joaquin General. Kind of walk us through. You had a couple of academic fellowships, and obviously you had your residency and you were chief resident,
yes.
Right? And didn't you also have a professional fellowship?
I did.
Am I remembering that correctly?
I was.
So why don't you step us through? So you finish your time here at Touro.
Yes.
You march across the stage, and then you're off to residency. So why don't you walk us through then to now?
I was actually led, so I went to residency in Philadelphia, and what led me to the East Coast was actually the opportunity from Touro to do my 3rd and 4th year rotations elsewhere. So a lot of folks who had families and had ties to the Bay Area stayed in California, but there was a couple of opportunities on the East Coast, Michigan, elsewhere in the country, and I chose to go to New York initially because I said, okay, I'm going to take this opportunity and leave. I want to learn something new.
Right.
And so I went to Philadelphia after my 3rd and 4th year rotations in New York and ended up doing a family medicine and emergency medicine residency program. And the reason why I chose a dual program is because I still, within me, have this drive to do everything. I just want to do everything. I want to learn everything that I can. This is my time. I don't want it to pass me. So I did a program in family and emergency medicine. I worked in a clinic at least once a week and then worked in the ER the rest of the days, which is a great experience. I would see someone in the ER, maybe see them in the clinic afterwards. And subsequently after that, during my time in residency, I also found myself doing a wilderness medicine fellowship. Again, I just wanted to know everything that there is to know in medicine in the hospital and in austere environments. So I did that program as well with the Wilderness Medical Society. And after that, after I graduated from residency, I was looking into fellowships because I thought this is my opportunity. What else can I learn outside of a separate residency, which some of my colleagues even did, if you would find that crazy. So I found myself in the medical toxicology world because of the colleagues and attendings who are around me that mentored me. And they said, you know, if you're looking for a fellowship and you really want to get deep into chemistry and biology and medicine, you should try a medical toxicology fellowship. And I felt like that kind of went very well with all of the programs that I did train in, including wilderness medicine, even travel medicine, family and emergency medicine, because there are quote toxins everywhere, and I like to say anything can be toxic just in the right amount, even water. So I felt that was very interesting and enlightening, and now I have that specialty in my armamentarium in terms of how to treat people, a very special niche in medicine.
Yeah, well, that's wonderful. So talk to us a little bit. I mean, obviously you interact with patients daily, and have since you started residency and probably before that, but you know, kind of taking more and more responsibility as your career progressed. I'm sure there have been times when patients have like touched your heart. Do you mind sharing some of those experiences with us when you know your job was more than your job?
Absolutely. And actually, as I think back about the patients that I've seen since I'm in the emergency department, just overall, my experiences with patients, you see people in their most vulnerable state. It doesn't matter who they are. They could be the most powerful person in the world, but when they're having an emergency, they're so vulnerable. And so that in itself I take to heart. But one thing in particular, and it's not even a complicated case or situation, I had a young man, maybe in his 20s or 30s, who had the flu. But he was in so much pain, he was just having the worst time of his life at that moment. And a lot of the staff, nurses included, and I can see this doing it myself. If you're in a very busy place and you don't have time, you look at him, you're like, why is he here? He could do this at home. Why did he come to us? And I had to remind myself, they come to you because there is some disease process. We say dis-ease. They're not comfortable, and you want to look for something emergent. Make sure there's nothing being masked by just what you believe to be the flu. Thankfully, he only had the flu, and we treated him. I said, okay, I know you're a strong young man, but what can I do to make you feel better? That's why you came here. That's why you came to me. We have an answer, and yes, you could do this at home, but you came here, and we want to help you. So I helped him. We gave him pain medications, fluids, just, supportive care, nothing crazy, nothing magical. And if he stayed for a while, and he felt better, and I was like, okay, bye, thank you. A month later or so, someone taps me on my shoulder where I'm working, and he says, Doctor, thank you so much. And I don't remember. Everyone had masks on. Who are you? What do you mean, thank you? I was that young man that you helped that day. And look, I'm a paramedic. I was like, oh my goodness. So we had, in order for you to do your job, we helped each other out. In your time of need, I helped you. And now look at you. You're carrying everyone in. I need you to do CPR. It was just this amazing moment, and everyone in the department heard because I was sitting in the middle somewhere, and all the nurses looked and like, oh, that's that guy. And now he's this big, strong, hefty guy in his uniform helping us. So you just never know who you're going to meet.
That's great. So you mentioned previously that mentorship, mentoring, being a mentor, being a mentee, helping people, having people help you. So we know you benefited from either informal or formal mentorships along the way, and then you rose to chief resident. I know there's a lot more to it than this, but my non-medical mind, I'm thinking chief resident and the stuff I see in TVs and movies and things like that, and it's like a fast-paced, high-stakes mentorship of the younger residents, not necessarily age-wise, but experience-wise, under your charge that you're supervising. Talk to us about the importance of mentorship, both informal and formal, both as a medical student and after graduation.
Absolutely. One thing that stuck with me ever since I was an undergrad student was the phrase, lift as you climb. I had plenty of mentors, even all the way down to elementary, middle school, high school, and I think it is so important to have someone who can hold your hand and take you through a path or lead you on your own path after they've done it, because it's almost like you have something inside you that you're not sharing somewhat. You go through all of this, a large path in life, either being chief resident or any leadership position, and yes, it's very fast-paced, but just knowing that you have someone that you can lean on. And that happens even in my time now as a new person in the hospital that I'm at. I seek others for help and mentorship. And I think it's really important because otherwise, without that, you feel almost lost. In these moments when I felt like I was by myself, potentially, and going through rigorous training, I don't know how I would be able to do it without having someone that I could ask questions and seek help from. And because I felt that, and almost, again, that vulnerability, I just couldn't go on without knowing that I could help someone else. So I look to everyone who's mentored me, and I felt I have to help and give back. Not to say in a forceful way that everyone has to do it, but I think it's so important, and it helps tremendously without leaving others behind, lifting them as you move up as well.
Well, that's wonderful. So obviously, the person who is receiving mentorship receives benefits. It goes almost without saying. As long as you're receptive, there's going to be a benefit from the mentorship. But as a mentor, what do you get from that side of the mentorship dynamic?
So interestingly, at least in the hospital, you could almost see yourself as being selfish. We have another phrase, see one, do one, teach one. This could be taking care of a patient or doing a very complicated procedure. After you see one, you do it yourself, and then you teach. And then after that, you probably don't have to do it anymore because you have someone who could do it for you. But in all seriousness, these are the people who are going to be taking care of you. Don't you want to invest in your future? So I think if I know that I laid my hands on or had some kind of impact or thumbprint on the youth, then I feel like we're in good hands because I did everything I could to teach them all that I know, just like those before me. And I know technology and medicine changes over time, but there are some parts, the humanistic things that you don't read in a textbook, that I hope that I can impart on those that come after me.
Oh, yeah. I'm going to do a shameless plug right now. There's an alumni mentorship program that was in place a number of years ago and kind of fell off because of the pandemic. We're getting ready to ramp that back up in the fall as a pilot program, and then hopefully in the spring ratchet it up to a more full-fledged program. So anyone out there who's interested in being a mentor to one of our students here on campus, please reach out to me and we'll get you in the queue.
And I'll hopefully be there for you as well. Just let me know how I can be a part of it.
Why don't you share with us the importance not only of having women, but women of color in the medical profession and serving the populations wherever you happen to be. In this case, Vallejo and Solano County.
Absolutely. Even going back to when we first discussed how I even wanted to go into medicine, at the recruitment event, the person at the booth was a female physician who looked just like me. She was also Filipino. If there was anyone else at the booth, of course, if I had interest, I would still join and want to go in. But that motivated me that much more to see someone in the field that I want to go into practicing medicine as well. And I see that when I take care of young children boys, girls, pronoun, whoever they are, but specifically when I do see a young girl and I come to their room and they say, "That's a doctor?" I say, "Yes, I am. And if you want to do this, you can be a doctor too." And they leave saying, "I want to be a doctor, me too." I think that's so uplifting, because otherwise, it's good to have diversity, and being a female person of color also helps, but there are so many different diverse kind of people out there, rather than just kind of uniform one way. You feel as if, okay, that's a field I can never get into. That's not something I can do. So I look to those, even like in the 1800s, the first female physicians. It's such a big deal, everything they had to do just to get into this field. And now we're seeing a 50% almost, maybe over, women in medicine. I think it's very important. And you just have these new diverse ideas, and you keep lifting others, and we all suddenly, it's not just one type of person in this field anymore. And I think that's really important.
Yeah, I mean, it's happening across all kinds of professions, and which is wonderful, but particularly important in a medical setting. When you start thinking about the history of how certain populations were treated by institutional medicine, and kind of some of the trailing effects of that.
Yeah, it's good to have a different set of eyes, a greater understanding, and that's when we as a team with a diverse group of people can come up with different ideas, rather than just doing the same thing over and over again and saying, "Why isn't this working?" Well, let's bring the people who are involved and let's come up with ideas on how to make this work.
So are you seeing a lot of multiple disciplinary things taking place in your current facility, and like since you've been out in the hospital realm?
Yes.
Because that used to not be the case. There used to be silos.
Exactly, you're absolutely right. And now we're doing a better job of trying to have these meetings or huddles with each other with different disciplines, across disciplines in terms of nursing, respiratory therapists, physicians, not only that, but also internal medicine, emergency department medicine, cardiology, all of the different disciplines. Kaiser does a really good job, I like to, as a spokesperson for them, but elsewhere too, in other hospitals, of getting us together and having us talk to each other, so that it's not just a note in a chart, okay, this person said this, the end of story. Now, okay, why did they say this? I see you face to face, we sit down together, we have a conversation. It makes so much sense now, and I didn't understand that before. So we have so much to learn from each other.
Yeah. So what advice would you offer to, well, let's start with current medical students, regardless of whether they're doing their classroom stuff now or whether they're getting ready to go off to residency. What advice would you give them to kind of keep the spark really hot?
Absolutely. I think a big thing is just remembering what brought you here. What motivated you? What made you decide to go into medicine? I know that's hard. School can be very difficult. And so another thing I say is don't give up. There are others around here to help you. And even when you feel down as if you're not going to finish, lean on someone, ask for help. That's what we're here for. It's not, you don't have to do it in silence anymore, and there shouldn't be any shame. We're here to help each other, and you're here for a reason. Let's get you on your path, and don't stop. Do not give up.
It's good advice for any field, not just for medical students. So we met about a week or so ago, and you got a little tour of campus. What'd you think?
I think it's beautiful. You taught me and I learned about your beautification project.
Oh yeah, it's beautiful.
It's so, everything, it looks so different. And when I was driving onto campus, I saw the signs, Touro welcomes you, a new logo for me at least, because I was here when the logo was green and orange, if you remember that I said. So there have been a lot of new developments. Even your SIM learning center, or the area where they practice patient encounters, that looks brand new. So it looks very clean, beautiful. I think you're definitely turning the campus and the island around. I think this place is so much more beautiful and better because of Touro.
And you know that the College of Osteopathic Medicine is expanding, right? With the incoming class, that we're getting ready to open Truett Hall, and a lot of the DO coursework is going to be happening there, along with other things as well.
That's going to be very exciting. Yeah, especially for the faculty who have more students to manage and take care of. I'm looking forward to how that will look like.
Yeah, I think this is the first increase in the number of students since shortly after the College of Osteopathic Medicine first opened 26, 27 years ago. I think there was a smaller class for a couple of years, and then it's been the same ever since until next year.
That's amazing.
Very exciting.
Very exciting. What a
exciting.
great place to be and a place to train. So I'm excited and proud that we'll have more people that can come through here.
Well, I think that's about it for us today. I want to thank you for taking time out of your schedule to come visit with us and visit with our audience. So on behalf of Dr. Dela Cruz and Touro University, California, I want to thank you all for listening. And until next time, take care, everyone.
Thank you so much.